Hi and welcome back to All About Hormonal Birth Control. In this series we discuss the side effects and effects of hormonal contraception, and in this episode we are going to answer the question, can hormonal birth control lead to depression? We are going to look at some Danish studies today that compare depression and suicide risk amongst women that are on hormonal birth control versus women that are not. Please remember that this content is for informational purposes only, and you should always speak to your doctor about your individual situation. Okay, now let's get back to the video. Ever since the pill came on the market in the 60s, women have been complaining about mood swings. And what we have seen throughout history and what we continue to see is that these complaints are often not taken seriously. I don't know about you, but when I hear about mood swings on the pill, I think of a minor thing like feeling a little extra irritable or getting a little bit more PMS than normal. And that is often how it is described as well. But some studies actually suggest that these side effects can be far more serious. So the first Danish study I want to discuss with you today is a study that was published in 2016. What's so amazing with Denmark is that they're able to collect data from their entire population by creating certain registers. And this study compared data from the National Prescription Register, which keeps information about all prescriptions being made, and the Psychiatric Central Research Register, which keeps information about all the psychiatric illnesses that are diagnosed. Now, as a Norwegian, I thought I could use this opportunity to brag about my fellow Scandinavian country because Denmark has provided us with some of the most important information we have regarding hormonal birth control and mood. The study included over 1 million females aged 15 to 34 years. They followed up these women for 14 years. They excluded the ones who already had a depression diagnosis, had prescription for antidepressants, and other major psychiatric diagnoses, cancer, blood clots, or those who underwent infertility treatment. The study reveals that after 6 months of being on hormonal birth control, women were 50% more likely to get diagnosed with depression and 40% more likely to get prescribed an antidepressants. Now we're going to look at this in more detail and break it down into product type and age group, because there are great differences here. So, users of combined oral contraceptives, which is just the regular pill, had a 23% higher risk of getting prescribed antidepressants. Users of the mini pill had a 34% increased risk. But there were two interesting things about this study. Number one, the highest risk was actually seen in the non-oral methods. Users of the patch were twice as likely to get prescribed an antidepressant. Users of the implant and the shot were more than twice as likely. And the increased risk of getting prescribed antidepressants for users of the ring and the IUD were 60 and 40% respectively. Now, the second interesting thing is that the highest risk was seen in the 15 to 19-year-old age group. Women between 15 and 19 years old using the combined oral contraceptives had an 80% higher risk. 15 to 19-year-olds using the mini pill were a little over twice as likely of getting prescribed an antidepressant, and 15 to 19-year-olds using the patch and IUD were a little over 3 times as likely of getting prescribed an antidepressant. Antidepressants are prescribed for other reasons than just depression, for example for anxiety. But the study also looked at the risk of getting diagnosed with depression and found that it was similar or somewhat lower than these numbers. The same researchers also published a study in 2018 where they wanted to find out if there was a link between hormonal birth control and suicide. And what they found was that women that were on hormonal birth control were twice as likely to have a suicide attempt and 3 times as likely to have a successful suicide attempt compared to women who were not on hormonal birth control. Now, as we saw in the previous study, the 15 to 19-year-old age group experienced the highest risk, and the birth control method that had the highest danger of suicide was the patch, with over 3 times the risk of suicide compared to women who are not on hormonal birth control. So I think it's important that we talk about what the data reveals, which is that there is an association between hormonal birth control and depression, and an association between hormonal birth control and suicide. An association means that there is a link, but it doesn't prove that hormonal birth control is directly causing it. What this means is that further investigation is needed in order to find out if hormonal birth control is directly causing depression. So, to answer the question, can hormonal birth control lead to depression? It can possibly cause depression, but further research is needed in order to know for sure. However, I think this information is very valuable for women to have, because since there is a possibility, women deserve to know about it. And I also think we need to be better at listening to women when they talk about how hormonal birth control makes them feel mentally. Because as I said in the beginning, women have been talking about this since the 60s. And we don't fully understand how it affects the brain or what the long-term effects are. And just because we can't prove that hormonal birth control is directly causing depression does not mean that women are not experiencing depression on hormonal birth control. So if you have a friend, a daughter, or a patient that comes to you to talk about this, then please do not discredit her. If you are feeling depressed, make sure to check out my video titled Depressed on Birth Control, 5 Nutrition Tips. And if you are on hormonal birth control and you feel great, then good for you. My goal with this video is not to scare you into not taking it. I simply want to share this information with you so that you can take that into consideration when you make a decision about your birth control. And I believe it is so important for women to know all the side effects and risks, not only so that they can make informed decisions, but also so that they know what to look out for if they do decide to go on hormonal birth control.